I think the 10-year plan will come forward with lots of opportunity to think about the left sort of shift. But I think what will emerge, particularly in these interesting times for NHS England and ICBs and so on, is a very strong recognition that we will need to take seriously and have the tools, techniques and frameworks for strategic commissioning. And by that really I mean thinking about allocative efficiency. How do we move our resources around in a way that maximizes the opportunity for change? The CIPHA type of platform that we've generated and can continue to grow, I think is going to be absolutely essential for the journey into the next 10 years of the NHS. Just a quick sort of press of 25 years in the making, but really I think very significantly accelerated in the last 5 years or so. But with 11 ICSs working together on building a digital health record, and not just the record, but the segue that gives us into population health, data-driven transformation programs. And particularly, I think, beginning to see and break down the connection between health and the drivers of health that so often sit outside the NHS, but which with appropriate data connections we can start to get insights onto. And covering 17 million citizens, and I chaired the CIPHA Programme, it was, for me, probably the very best worked example I'd seen of frictionless cooperation across the system, because when we talked about the CIPHA Programme, we talked about a set of principles. It was very much a bottom-up sort of process. It was based on a philosophy that this was fundamentally the right thing to do. And, you know, with a number of colleagues, we were very much focused on the notion that in the heat of COVID, we needed this sort of information to generate actionable insights that would allow us to do some really different things.